The stars are bright, we own the night. The stars are bright, we own. The stars are bright, we own the night. The stars are bright, we own. The stars.
Hello to another episode of No Better Time Than the Present. We appreciate the support of this podcast, if you will. And we have another awesome guest this evening, and I'm very excited to hear a little bit about her story. So, today we're speaking to Elizabeth Medeiros. Okay, and please correct me, Elizabeth, when you come on, if I said your name right. So I just want to give a little, like I said, a little premise to what we're going to talk about today. We're speaking to an advocate who reps, if you will, the juvenile onset psoriatic arthritis. Okay, which is a very fascinating conversation, I think, because the last couple of guests that we had were people who were diagnosed with whatever the situation was at a younger age. And we know sometimes our experiences are different when it's from a younger person's perspective. So I'm excited to get this conversation going. But before I started, I just wanted to set it up exactly what is JA, juvenile arthritis. And perhaps Elizabeth can explain a little bit the term and all of that. So, juvenile arthritis, known as pediatric rheumatic disease. I hope I said that right. JA, which is juvenile arthritis, is one of many types of autoimmune or autoinflammatory diseases. And in this case, that affect children under the age of 16. There are about 300,000 children and teens affected by this. Okay, let me quote this again. 300,000, which is stunning, you know. So, the immune system that is supposed to fight against foreign attackers such as viruses and germs are confused and release inflammatory chemicals that in fact attack healthy cells and tissues. The most known symptoms are joint inflammation, pain, and tenderness, as well as skin disorders in some cases. So, as we've been doing with the past episodes of No Better Time Than the Present, I wanted to give what some of the myths are with this particular condition and what is fact. So, an adolescent can outgrow this condition. You know, you figure, okay, if you were diagnosed at 10 or 9 or something like that, as you get older, it'll kind of work itself out. The fact is that there may be periods of a remission. There's a point where the disease can be present lifelong, but with the ability to manage it through duration. So, I think it's similar to myeloma to some degree in terms of you may get to that remission part, but as they say, it's still in there, you know. So, only the joints are affected with juvenile arthritis. Okay, the fact is, in most cases, that this is accurate. However, pain may not be the only factor, as the skin may be an issue, may have certain skin issues, there may be weight loss, there may be eye issues, vision, maybe other call-outs to symptoms as well. And lastly, There are many specialists that can treat this condition, which this part I found rather interesting. And the fact is that this is not totally accurate, as there are many rheumatoid specialists, and we're going to end it like that, in the United States that are available for this type, or are available to treat this type of diagnosis. And those easily available are located at learning or teaching facilities. Therefore, it's difficult based on where you live to get the best treatment. So I found that rather interesting. So I wanted to again set that up as we wait for Elizabeth. She can pop on whenever she's ready. And that way, and actually as we're getting her situated to come on, I'm going to actually read her bio, because I want to get into this amazing conversation we're getting ready to have. So, Elizabeth Medeiros is a young adult who has dealt with juvenile onset psoriatic arthritis since she was a small child. In addition to other for her undergrad in design in Boston, she has kept a blog, The Girl with Arthritis, since the age of 14. Hi!
Hi.
But how she's coped with chronic pain from such a young age. She also is a contributor for Health Union and previously was a columnist with Bio News Science. Elizabeth hopes to inspire those living with psoriatic arthritis and juvenile arthritis by sharing her story and offering practical tips on coping, emotional wellness, and advocating. Elizabeth enjoys crocheting, making art, traveling, and cooking when she is inviting. You can learn more about her by going to her blog, thegirlwitharthritis.com, as well as following her on her Instagram, which she'll say all of that stuff again when we're done. So I just wanted to set that all up. And how are you doing today?
I'm great. Great. How are you?
I'm doing well, thank you. So thank you for coming on, having this conversation. As people come in and on, you know, that's kind of how they do. They pop in, some pop off, some come on later. It'll be a good time regardless. So how was your day?
It was good. It was good. I worked today. It's a long day, so.
A long day. Okay, well, we're gonna try not to have you too long, you know, as you share your journey and your experience with us. So before I get into the questioning, can you give us a little bit about the beginning, a brief synopsis of how did this all come upon you?
The disease or the advocacy?
The disease.
Okay, so I really can't remember a time when I didn't have a lot of pain, because, you know, I was just a very sensitive little kid, and I had a limp and all these types of things that, you know, when I first started walking, my mom noticed that I already had a limp, especially when I was tired. And, you know, we kind of always had these little signs pointing towards juvenile arthritis since I was clearly very young. And, you know, I was the product of a medical system that is just very sexist and dismissive, I think, because I, you know, had a mom who was very concerned, and she was a first-time mom, so she got dismissed a lot, like, you're being a helicopter mom, you're being overcautious, that type of thing. But I continued to develop normally, thank God. And when I was 8, I had my first flare-up, which was so severe. I was actually hospitalized for quite a bit, and I had, you know, beyond just the pain, I had like severe fever. I had like other, you know, systemic type symptoms. And we continued to see doctors. We continued to seek a diagnosis. But it really kind of came back to like, we can't really find anything wrong with you, so you just need to exercise. You just need to push through the pain. And I'm really fortunate to have a mom who continued to help me, you know, find a diagnosis. And I finally was referred to a rheumatologist around age 12. And I was under the care of rheumatology for 2 years before they really figured out that I had psoriatic arthritis specifically. Part of that was that I never had skin psoriasis. I never had psoriasis like that was very visible. Um, and part of it was also that psoriatic arthritis wasn't a very common diagnosis at that time for children, and it's still not a common diagnosis, but there's a lot more awareness around it now than there was 10, 15 years ago. And I've had the same diagnosis since, like, it's juvenile psoriatic arthritis, but it's technically, now that I'm not a juvenile, it's juvenile onset arthritis.
Right.
So yeah, it's been a long road.
It's been a long road. It's interesting because I know, like I had said earlier on, we've had two guests like not long ago who were at a certain age. And I guess just like anyone who is a little older, I guess everyone kind of falls into the same bucket in terms of what doctor you may get, and in terms, do they really hear when you say you're not feeling well or whatever the situation is. And I can imagine for someone who's extra younger, in the preteen, stage, when you say you're not feeling well, and I feel like sometimes some doctors, not all, they have this script of, oh, we'll just exercise. That seems like to be the famous thing to say, which that's not always the case. I think part of that too, they don't know everything. I think that's what the consensus is. So though they went to med school, this, that, and the other, I think some go on with this basic knowledge. Okay, oh, you have a cold. Oh, you have the flu. But when it gets down into those deep core issues, I think sometimes it may go over their head. And then that's unfortunately where the advocacy has to continue. If you're not feeling well, you have to constantly be on them.
Right.
And if you don't know, then who else do I need to speak to help me figure this out? So it really is a puzzle. So what I wanted to ask, I have a list of questions that I have, so I'm just going to be pulling out different ones. How common is JA? And is it JA, like, I think you did explain a little bit, you said as you get older, as a young adult, it's really onset versus juvenile arthritis. So do you want to explain a little bit about the terminology?
Sure. So juvenile arthritis is, an all-encompassing term that we use for rheumatic diseases for kids. And there's many different forms. So in my case, like, I have a subset that's called psoriatic arthritis. And then there's others that kind of go with it. And the base of what juvenile arthritis is their autoimmune diseases, autoinflammatory diseases, where your body cells are very confused and they start attacking your own body. For children with juvenile arthritis, that presents in very, very many different ways, but for all intents and purposes, we'll talk about like juvenile idiopathic arthritis, juvenile psoriatic arthritis, which are similar. They have some differences, but they're the type of juvenile arthritis I think most people are thinking of, where, your joints are being attacked more or less. Like, that's where a lot of that inflammation is going. And it's not exclusive, certainly, to the joints. It's just one of the more common ones. These kids can also experience their inflammation in lots of different ways. Like, some kids run fevers, and I actually run fevers when I'm in a flare, which is, not very fun. But running fevers, for kids with psoriatic especially, sometimes that inflammation goes into their ligaments and their tendons. I was actually misdiagnosed with tendinitis by a renowned orthopedic specialist, apparently, because he looked at one look at the x-ray and saw inflamed tendons. So he wasn't quite wrong, but he wasn't quite right either. So yeah, it's really just an all-encompassing term for kids that deal with these very painful autoimmune conditions that are, a lot of people, I think, hear arthritis and they don't think it's very dangerous, but it can cause, you know, severe issues for these kids. As you mentioned, you know, eye issues too. A lot of kids actually have arthritis go right to their eyes, and they can cause blindness. I do have a friend who's legally blind from it. So yeah, and also just to cover too, yeah, it's one of those things that's you don't quite outgrow it. A lot of kids are very fortunate, especially now, because the medications are a lot better than they were, you know, even 5 years ago. And they will achieve remission in adulthood, and they might not have issues as an adult. But it is one of those things that's, you know, it's never cured. It's you always have it. You just go into remission.
Right. So, is there any testing? Like, you know, you have your specialist that you see. Like, how often would you see if you're in a remission stage? How often would you check to see if everything is good, or is it just your body reacting to here we go again?
Yeah. Well, for kids with juvenile arthritis, at least I was seen once a month.
Okay.
When my body was just like not in a flare, but not in remission either. And that's because it can affect the growth patterns really badly. So they want to keep an eye on these kids. So I can imagine that with flares, it might be more often. And, you know, during the better periods, I remember cheering one time when we got to go 2 months without seeing the doctor, 3 months without seeing the doctor. Like, that was big news. And for every child, it is very different. So with psoriatic arthritis, it's one of these types that we consider like, I think it's called seronegative. And what it means is like there's no blood test as such to show that, like no official blood test. There are blood markers, but it can be harder to track in that way. It's a harder disease to diagnose and to track, just because, you know, you can't look at one lab result and say, okay, you're doing good this month. Okay, you're not doing good this month. So it's really up to the doctor to take a holistic approach to it, where they're looking and they're noticing the growth patterns. They're, you know, looking at your gait. They're listening, because, you know, your joints might look okay, but if you're suffering from a lot of fatigue and that type of thing, clearly you're not doing okay. And you might even use other diagnostic tools that are kind of you know, special to the individual. Like, I used to go for a lot of ultrasounds because the x-rays can't really pick up the swelling in the ligaments the way an ultrasound can. I hope that answers your question.
Yeah, it does. So with the testing or the things that maybe the doctor may be aware of to know if this is where it's going or if it isn't, is part of that, does that include any type of biopsies of the joints or anything which is a little invasive?
I don't think the kids face as many types of like joint biopsies or fluid biopsies, but certainly like psoriasis biopsies. If they have psoriasis on the skin, they will take a sample to like test to see if it's psoriasis. I don't actually have it on my skin. I have it on my nails. And I remember that being taken, and that's not terribly invasive, but for children with certain types of juvenile arthritis, and even psoriatic arthritis, actually, I don't know why I said it's not as common. There are times when you might have a lot of fluid accumulation in a joint. And so a doctor will remove, I mean, it just has to be removed anyway. It's not really a biopsy at that point. And so they'll like essentially go into the joint with a needle and drain the fluid. And they'll test it to see if it has maybe like a lot of white blood cells, that type of thing. But I don't know really how common it is. I've definitely talked to other kids with juvenile arthritis who've gone through that. I got really close to having to do that, but thankfully didn't. But, you know, beyond that, it's also just kind of the normal invasive stuff too, like blood tests and MRIs, and some kids have face surgery and things like that.
Wow, that's very interesting. Okay, so as I mentioned before, I can imagine as a child, you know, it's bad enough, I think, at any age, anyone having to deal with any type of chronic condition or what have you. But how difficult can it be for a child to actually break down the type of pain that they're coping with? And from a young person's perspective, right? I mean, we know as you are older, you know, you can say, okay, my head hurts, then the pain feels like this, and the pain feels like that. So if we look at someone who is extra young, you know, where they are still vocal, but then I don't know, like part of the question is, do you feel like is there a bias to a younger individual trying to express what they're going through?
Heard constantly like these phrases like children bounce back, children are hardy, children, you know, that type of thing. Like kids can go through a lot. And I mean, I do think kids bounce back. Yes, they're very resilient. I think that's the word we're looking for, they're resilient. But they still feel it, you know, and they don't have the words to always say it. Unlike an adult, like you said, that can say, oh, my head hurts. The child can't really say that, or the child doesn't always realize something's wrong, especially if that's normal for them. Um, when I used to write my juvenile arthritis column, something I used to point out is that your young child is probably not going to say like specifically like, oh, my leg hurts. You're going to notice limping, you're going to notice swelling, but they're not going to say that. They're going to refuse to play. They're going to be cranky. They're going to, you know, they're not going to be pleasant child, generally speaking. And that's, I'm not even saying that, you know, as an insult to toddlers or preschoolers, because I think we're all kind of like that. When you're not feeling good, we're not all really pleasant. And so I think that's really, really hard, you know, because it's hard for, you know, it's hard to pick up on problems when the child's able to cope, but it's really also hard to advocate for your child too when this is their normal, so they're kind of used to it. They don't know to show the doctor this or show the doctor for that. You know, they're going to be perfectly fine the day you go to see the doctor.
Right.
So I think that's why, you know, for me, especially with juvenile arthritis, like advocacy is so important, just because I was one of those children that I was very hardy. And, you know, I had my moments of I was sitting on the couch and I didn't want to play, but that doesn't usually warrant a doctor's appointment, you know? I just learned to cope with my reality.
Okay, so I know we've kind of spoken through technology, if you will, in terms of some articles, some very good articles that I read. One that you wrote, which I thought was very interesting, and that's like a young person's perspective of, I guess, having this relationship with their parent in terms of how you're feeling, forms of depression, or whatever the case is. Do you want to speak a little bit about that?
Yeah, I mean, I think it's one of those things that for the child with any chronic illness, not just this type, you know, the parent is the lifeline, and having a good relationship and feeling that trust with your parent is so important. Um, and so that's actually kind of why I took so much pride in my juvenile arthritis column, because I didn't really write it for people with juvenile arthritis. I wrote it for their parents, first and foremost. And yeah, I think, you know, like, yeah, having that relationship is important, and especially with their mental health too, because I personally remember as a teenager, especially like, you know, going through hard periods, like realizing that like I just been through all this medical gaslighting, I just been through all this stuff, and you know, it was hard, but I was really thankful to have like a supportive parent by my side, and also just have like all this technology by my side as well to like make me feel not so alone. I don't know if that quite answers what you're looking for, but you know, it is kind of just one of those things that's like, you know, with a pediatric disease, having your parents there and having to like navigate every stage of life is so difficult.
It is. I mean, it's crazy as you become an adult, you know, but just think of that, just the flip side of that as a young person. You know what I'm saying? There's like so many different things in general having to grow into this adult, you know, and then on top of it, you have this going on. So have you met like any resistance from any of your friends or family in terms of what you can and you can't do, and when you have certain flare-ups?
Oh, definitely. I have as an adult, it's been really nice because I get to decide my own limits. When you're a child, unless you have a very supportive parent, you don't really get to decide your limits. Your body will decide for you, of course, but at the end of the day, like, mom and dad gets to decide whether you get the wheelchair in Disney World or not. Um, and so I've definitely had a lot of, kind of pushback in funny ways. It's really hard to have an invisible disease because, well, people can't see it. They forget to help you, and they forget that you are, like, for lack of a better term, suffering. So definitely there are times that when I was a kid, I got from adults like, oh, you're young, you're fine, you can push through. And it's like, well, I can, but I'm going to pay for it for the next week. And then especially, yeah, with friends, like some friends were very, very understanding. And I didn't really expect that type of empathy from children, really. And then I had friends who were like less than empathetic because they were, it's boring to have chronic pain. I can't walk the mall quite as fast as you. I don't want to play sports, or, I'm not very good at sports, frankly, because I'm really clumsy. That's another juvenile arthritis thing. So yeah, it was just kind of hard to navigate that whole, like, I felt like I had pressure from, my parents to meet certain types of like expectations, like push my boundaries. I had expectations from adults around me to push my boundaries. And then I had that like societal pressure too from my, my friends, my community.
Right.
Yeah.
It,
You can still face that, I think, as an adult, but I think it's a little bit easier to tell people to back off.
right, right. It's funny because I can relate in terms of, as you mentioned, the invisible disease, like with multiple myeloma, which is like a bone marrow cancer. It depends. Like you have a whole, variety of patients. Some patients go through this, some go through that. But generally, like not the only, there are, like I said, there's like a variety of possibilities of what can happen. But I guess I'll just use myself as an example. I would go to work looking like nothing is wrong. You know what I'm saying? Because that was my business. I'm able to do what I have to do. If it's invisible, just okay, it's invisible. Like I know what the situation is, Other people just assume, but they don't know what they're assuming because they don't know. You know what I'm saying? So I totally get that. And I also get the whole thing, as you become older, there's certain things I guess you can maneuver around, the situation. But there is that humans are funny. So it's that thing of, oh, you don't look sick. So a lot of people feel if you're not bleeding out your nose every day, if you don't have, like, I don't know, looking crazy or whatever, then that means, oh, you're fine. So some of the comments that you said, oh, you're young, you'll, snap back into whatever, right? How do you snap back from joint pain? You know what I'm saying? Like, I think even for older individuals, they can say, as they become older, they have certain joint pains, which is arthritis or different forms of arthritis. So I think that's kind of interesting. So do you feel overwhelmed at times? And if so, how do you regroup?
Oh, I definitely do get overwhelmed at times. I'm actually quite overwhelmed at the moment with my own disease because I'm in a little bit of a flare and I'm having an issue getting the medications I need. So this is really good timing for that question.
Wow.
But something that I do and I've done since I was a kid was write. I like to write about my experiences. I think it just makes me feel like I have like a purpose, I guess. It just, it, I think it helps me because I'm being creative, but I also feel like I'm helping people. So that's one thing that I like to do. Um, and then for me personally, hobbies have been such an important part of just coping with this disease. And there are times that, like, hobbies are even too much. Like I couldn't sit up. Like I didn't really have much going on. And I think generally speaking, it's really hard, but trying to be positive and finding positive things every day is really important coping mechanism. Like it doesn't need to be like, like, oh, I feel so positive about life, like everything's great, because that's not really realistic. But like a funny example is at one point I used to look really forward to getting the mail every day. Um, and it's just something really silly and stuff, but it was something to kind of keep me going. So I think during those times, that's really important. I think there's also something to be said too for like, you know, my own personal like spiritual side too, that also helps me cope, but I don't really want to get into that as much.
Right, right. I totally understand. So I know for myself and what I kind of state, to a lot of people is for me, I I live my life as just staying in the present. So we got through today. Okay. So let's just focus on today. And tomorrow, that'll be what tomorrow's going to be. So I think how you kind of peel back the layers of how you cope and embrace, if you will, whatever you have going on makes a huge difference, like just the analogy that you use in terms of the mail is very interesting, where somebody else, I don't know, maybe they'll have orange juice every day. I don't know.
Or,
Let me get
you look outside and you see, all the flowers are blooming a little bit more, oh, the squirrels in the backyard again. It's just the little things.
right. And they matter, those little things, that's our kryptonite to get through whatever we have going on. So who would your plus one be if you were to share your story, let's say at a medical advocacy conference? And why would you pick that particular person?
Oh, I'd have to say my husband actually, because I think he's the one person in my life. I love my mom so much. She's amazing, and like I said, she was my first advocate, and she did a really, really good job with the circumstances. But my husband, obviously, we have such a different relationship. He's seen me at my worst, and he's had to like play that role of caregiver, and he's seen me at my best, and he's always been so accommodating. Like if anything, he's been the one that has really taught me like, you don't have to push the boundaries anymore. Like the teachers aren't here anymore, like the coaches aren't here anymore. It's just me, and I'm going to take care of you, like that type of thing. And so I think definitely if I was going to give a speech or talk, I'd want him there because I kind of want that presence of like, I have that one person there who supports my needs fully.
I totally get that because my ride or die is my husband as well. And he's seen definitely me at my worst. It is, I think it gets emotional in terms of some of the things that he's seen that probably scared the bejesus out of him. But it's like we got through it. You know what I'm saying? We got through it. So what is your favorite dessert when the your day is going well, your health is going well, there's no flare-ups? Like what is your treat that puts you in that keeps you in that happy place?
Ooh, that's a really, really good question. I'm a big donut person. I love donuts. There's a place that I grew up nearby that makes handmade donuts, and they're the size of your face. So definitely donut.
Wow. Yeah, that's some big donuts, girl. So this was a very interesting conversation. I think a lot of the viewers will gain some understanding in terms of the terms, that we spoke about, and just another journey of another condition. So what parting words would you like to tell those who are newly diagnosed? And I gather that would be a younger person.
Yeah. I mean, I think whether you're, a kid or a teen or young adult or whatever, I think when you're diagnosed with an autoimmune arthritis, the first thing I always say is remember it's not old people's arthritis. And I've heard that phrase for years, and you know, I've been told it before by other kids with juvenile arthritis and even doctors and stuff. And, you know, so I know it just resonates with people to hear that it's not your grandma's arthritis. And it's not to say grandma's arthritis isn't painful, because I know it is, but you have something completely different from her. You have an autoimmune condition. You need to take good care of your body. And, you know, this condition requires a lot of patience and just self-care. You know, pushing your limits and doing bad things for your body is only going to make it worse. You need to learn to work with your body, and hopefully it'll start to work with you. But most of all, just, you know, try to take care in the fact that this is a very, very difficult condition to manage. And, you know, even if you flare, it's not your fault. You're doing good.
That's wonderful, wonderful advice. Just to piggyback off of that a little bit, when you say self-care, what are some examples of that? Because I think for a lot of people, when they think of, and you know, arthritis, you know, okay, it's too painful for me to do anything. Would you, like, what self-care would you think? Would exercise be included in that, or is that something that is frowned upon because maybe that's not the best route to go?
Yeah. Exercise is a great one, actually. People with arthritis definitely should exercise when they can. I think the self-care part of it comes from just don't overdo it. You probably have, I mean, maybe not, I don't know. Some people with arthritis are in really great shape, but you might have a lower tolerance, especially depending on how your body is. If you're not in a flare, if you're in remission, you might be able to go running. But if you're in a flare, you need to take it gentle, but just don't stop moving. Like doing things like swimming and Tai Chi. My rheumatologist does not like yoga. She likes Tai Chi because it's good for your balance. And it's not as much stretching. So just kind of taking things where you are. And I think to that point too, when I say, you know, take care of yourself, it really kind of comes down to listen to your body. And it doesn't mean you have to overdo the rest, but it does mean, like, you know, if you're feeling excessively tired, you might have a flare coming up, you should rest. You don't push the boundaries too much, and take care of yourself mentally as well. I think, you know, continuing to do the things you love in a way that is adapted for you is very important. So I'm very much an art person, and there are times that I can't do art. So I filled my home with art, and I look at art all the time on the internet, and I have art friends, and, you know, that's kind of my daily dose of art.
Right. That's wonderful. And what you just said, I think a lot of people, whether it's arthritis, whatever it is, I think we all can relate to that in terms of the proper or the best steps to care for yourself, you know, despite whatever you're diagnosed with. There are things that you can still do, you know, there are things you can still live and do. You just may have to do things a different way than
Exactly.
everyone else,
Right. Life
you know.
doesn't stop for arthritis. You got to keep going.
Exactly. And one comment that we have here also, that you are not alone. So we thank you for that, myeloma and me. Very good. So how and where can the viewers who are on now and those who see the replays later, how can they learn and find out more about your advocacy?
So definitely by checking out my Instagram, which is, you know, at Girl with Arthritis. I think that's where I'm most active right now. I also have a blog, thegirlwitharthritis.com. Additionally, if you're more interested in kind of seeing my writing, I write for psoriatic-arthritis.com. And then I had a juvenile arthritis column at juvenilearthritisnews.com. All those columns are mine. You don't have to sort, so that's my shameless plug. But yeah, definitely anywhere there you can learn more about me and my experiences and get advice for those conditions.
Wonderful. So again, I really appreciate you taking the time. I know you had a long day, so I don't want to keep you too long. I really appreciate you coming on, educating folks in terms of what is juvenile arthritis and sharing your story. Had some wonderful discussions from some awesome advocate including Elizabeth. So thank you again, Elizabeth. You and I will be in touch off screen in terms of, the thank yous and all of that good stuff.
Yeah, thank you so much.
Oh, what someone said, thank you for sharing your story from a fellow arthritis and myeloma patient. Thank you for listening and joining. Wonderful. So thank you, Elizabeth.